Human osteology. The study of bones is known as osteology. This is the branch of anatomy that deals with the various bones of the human body. It forms the basis of the anatomy of the musculoskeletal system. Bones are the building blocks of the skeleton and are heavily impregnated with calcium salts. They provide support for the soft tissues and form the parietal wall of certain cavities housing delicate organs, viscera, the brain and the sense organs. Classification of bones. Bones can be classified into 4 groups or categories. Flat bones, long bones, the short bones, irregular bones. They are considerably larger than the other 2 in terms of length. Found in the limbs. They always have a central part, called the diaphysis, and 2 ends called the epiphyses. They are significantly smaller in 1 dimension, thickness, than the other 2. Scapula, skull and ribs. These bones always have 2 faces and a variable number of edges and angles. Their 3 dimensions are almost equal, they are more or less cubic. These are the bones of the carpus and the tarsus. These bones usually have 6 faces, with corresponding edges and angles. Complex in shape, the vertebrae and certain bones of the skull, as well as the bones of the pelvis. It should be noted that bones have identifiable features that determine their shape. There are 3 types of surface. Flat bone surface. It is a flat, smooth surface. Depressions, hollow bone surface. Croys varying in depth. They are given different names depending on their shape: fossa, groove, sulcus, notch, indentation, etc. Bony protrusions, raised bone surface. Raised depending on the shape of the raised area. They are given various names: bumps, apophyses, tuberosities, protuberances, eminences, tubercles, processes, crests, spines, etc. In addition to these surfaces, there are the channels and the atlas cavities. The color of bones. Bones look different. They are pinkish-white in the living body and yellowish-white in the corpse. The number of bones. The human body contains 206 bones of different types. This number sometimes varies due to the presence of supernumerary bones, sesamoid and wormian bones. The longest and heaviest bone is the thigh bone, the femur, around 50 centimeters for a man who is 1.80 m tall, whereas the smallest is the stapes in the middle ear, approximately 3 millimeters, and weighing between 2 and 4 milligrams. Division: the skeleton. The human skeleton can be divided into 2 parts. A. The axial skeleton. It is situated along the body's long axis, which runs from top to bottom and consists of the skull, which contains the central nervous system, the meninges and the initial segments of the 12 pairs of cranial nerves. The hyoid bone. It is a horseshoe-shaped bone with no joints. Dimensions. There are 12 pairs in total, of which the first 10 are attached to the sternum. These are known as the true ribs, whilst the remaining 3 are false ribs, and 2 are floating rib. The spine. A canal has been formed within it. This is the spinal canal, which houses the spinal cord and the spinal nerve roots. Comprising 33 vertebrae, it is divided into mobile spine, 24 vertebrae comprising 7 cervical vertebrae, 12 thoracic vertebrae, and 5 lumbar vertebrae. Fixed column, 9 vertebrae, 5 fused sacral vertebrae, the sacrum, and 4 fused coccygeal vertebrae, the coccyx. B. The appendicular skeleton. Symmetrical, attached to the axial skeleton, formed by the bones of the upper and lower limbs. The upper limb, divided into 3 parts, arm, forearm and hand, comprises the following bones: humerus-arm. Radius, ulnar-forearm. Carpal bones, metacarpal bones, phalanges-hand. The lower limb, which is also divided into 3 parts, thigh, lower leg, foot, comprises the following bones: femur-thigh. Tibia, fibula-leg. Tarsus, metatarsus, phalanges-foot. The limbs are attached to the trunk by belts. The shoulder girdle, comprising the 2 clavicles, the 2 scapulae and the sternum, attaches the upper limb to the trunk. The pelvic girdle, the 2 iliac bones and the sacrum, attaches the lower limb to the pelvis. The role of bones. One, support. The skeleton is a rigid structure that provides a framework for soft tissues and organs. 2. Protection. The skull, spine, rib cage and pelvic girdle enclose and protect the vital organs. The sites where blood cells are produced are protected within the cavities of certain bones. 3. Movement. Bones act as levers when the muscles attached to them contract, causing the joint to move. 4. Storage of minerals and energy. The bone matrix consists mainly of calcium and phosphorus. These elements can be mobilized in small quantities and used to meet the needs of other parts of the body. Bone tissue also stores magnesium and sodium in small quantities. The fluids stored in the fat cells of yellow bone marrow constitute reserves of energy. 5. Hematopoiesis. In adults, the red bone marrow produces red blood cells, white blood cells and platelets. Bone development and growth. Osteogenesis. This is the process by which bone tissue is formed, either from a fibrous matrix or directly from fibrous tissue, resulting in a type of bone known as membranous bone. Either from a temporary cartilaginous model, resulting in thin chondral bone. Different types of ossification. 1. Membranous or fibrous ossification. This is the direct and progressive transformation of embryonic mesenchyme, TC, into bone tissue. 2. Cartilaginous ossification. It begins as early as the 2nd month of gestation and results in the formation of a cartilaginous model. 3. Enchondral ossification. Ossification begins within a pre-existing cartilaginous framework. Structure of long runs. A long bone comprises the diaphysis, or body, in the center of the epiphysis at each end. Inside the diaphysis lies the medullary cavity lined by a thin layer of connective tissue, the endosteum. The medullary cavity contains the lipid-rich yellow bone marrow. The epiphyses are made up of cancellous bone surrounded by compact bone. Red bone marrow is found in the pores of cancellous bone. The epiphyseal plate, which is the junction between the diaphysis and the epiphysis, is a region of intense cell division responsible for the longitudinal growth of bones. The epiphyseal line replaces the epiphyseal plate once bone growth is complete. A connective tissue, the periosteum, covers the bone and serves as the point of attachment for muscles and tendons, as well as the site of diametric growth of the bones, growth in thickness. Spongy bone. Flat, short bones. Blood supply to the bones. Bones are supplied with blood by nutrient and periosteal vessels. 1. Long bones. * diaphyseal arteries. 1 or 2 feeding arteries pass through the diphyseal feeding foramens and enter the medullary canal, where they divide into caudal and cranial branches. The anastomosis results in a second-order artery. These diaphyseal arteries supply the inner 2/3 of the compact bone and the medulla up to the metaphysis. The epiphyseal and metaphyseal arteries supply blood to the cancellous bone. 2 flat bones. Multiple feeding arteries enter the foramina and branch out into the cancellous bone. The periosteal arteries run through the periosteum and supply blood to the surface of the bone. 3 short bones. They do not have periosteal arteries. Study of the skeleton. One, the axial skeleton, the skull. The skull is made up of 8 cranial bones qui est articulant solidement les uns avec les autres pour infirmer et protéger l'encéphale et les organes sensoriels associés, et les 14 os fasciaux qui forment l'armature de la face et permettent l'ancrage des dents. The base of the skull is formed, from front to back, by the ethmoid bone, which forms the walls of the nasal cavity, surrounded by the frontal bone, the sphenoid bone, the 2 temporal bones and the occipital bone. The bones of the skull are joined by immovable joints, the sutures. The coronal suture connects the frontal bone and the 2 parietal bones. The sagittal suture is located between the 2 parietal bones. The lambdoid suture is situated between the occipital bone and the parietal bones. The squamous suture is located between the temporal bonal at los parietal. The facial bones include the upper jawbones, upper jaw, the lower jawbone or mandible, the 2 palatine bones which form part of the structure of the bony palate, the 2 zygomatic bones, cheekbones, the 2 lacrimal bones in the medial wall of each orbit, the 2 nasal bones forming the upper part of the nose, the vomer and the inferior turbinates, which are located in the nasal cavity. The ossicles of the middle ear are located in the petrous part of the temporal bones. These are 3 small bones, the malleus, hammer, the incus, anvil, and the stapes, stirrup, qui amplifiant et transmettent les sons de l'oreille externe à l'oreille interne. The hyoid bone, a horseshoe-shaped bone, is located in the front of the neck, between the tongue above and the larynx below. The spine Rachis, provides support and enables movement of the head and trunk, and serves as an attachment point for muscles. The vertebrae support and protect the spinal cord and allow the spinal nerves to pass through them. The vertebrae are separated by fibrocartilaginous intervertebral discs and are held together by the articular processes and ligaments. Movement of the vertebrae relative to one another is limited, but movements involving the lengthwise extension of the spine are possible. Between the vertebrae are openings through which the spinal nerves pass. These are known as the intervertebral foramina. The adult spine has 4 curves, the cervical, thoracic and lumbar curves, which are named after the regions in which they are located. The pelvic curve is situated at the level of the sacrum and coccyx. The ribcage it consists of the sternum, the costal cartilages, and the ribs attached to the thoracic vertebrae. The rib cage supports the shoulder girdle and the upper limbs, supports and protects the thoracic and upper abdominal viscera, provides a large surface area for muscle attachment, and plays a major role in respiration. The different parts of the sternum are the manubrium, the body, and the xiphoid process. Only the first 7 pairs of ribs are attached to the sternum by costal cartilages, and are true ribs, vertebrosternal ribs. The following 3 pairs are false ribs. The 8th, 9th and 10th ribs attach to the costal cartilage of the 7th rib, vertebrachondral ribs. The 11th and 12th ribs are not attached to the sternum at all and are known as floating ribs, vertebral ribs. Each of the first 10 ribs consists of a head and a tubercle that allows it to articulate with a vertebra. The 11th and 12th ribs have a head, but no tubercle. All dimensions consist of a neck, an angle and a body. The bones of the appendicular skeleton. The appendicular skeleton comprises the bones of the shoulder and pelvic girdles and the bones of the upper and lower limbs. The belts connect the limbs to the axial skeleton. The shoulder girdle consists of 2 shoulder blades and 2 collarbones, which are connected to the axial skeleton at the manubrium of the sternum. The shoulder girdle serves as an attachment site for many of the muscles that enable arm movement. The clavicle, the S-shaped structure, connects the upper limb to the axial skeleton and keeps the shoulder joint away from the trunk to allow freedom of movement. The muscles of the trunk and neck are attached to the collarbone. It consists of 2 faces, top and bottom, 2 edges, front and back, and 2 vertices, lateral and medial. Set up at the bottom, the surface crisscrossed by a groove. On the outside, the flattened end. Forward, the concave edge of this end. The shoulder blade, the scapula, is a flat, triangular bone situated behind the rib cage, between the 2nd and 7th ribs. It articulates with the clavicle and the humerus. It extends along the posterior region of the chest wall and is attached to the axial skeleton by muscles. It consists of 2 faces, front and back, 3 angles, bottom, top, middle and top side, and 3 edges, top, side and middle. Set up forward, the concave side. At the top, the scalloped edge. On the outside, the oval articular surface. The upper limb. The upper limb consists of the arm, which comprises the humerus, the forearm, which comprises the radius and the ulna, and the hand, which comprises the 8 bones of the carpus, the 5 bones of the metacarpus, and 14 phalanges. The humerus. It is a long bone which, on its own, forms the skeleton of the arm. It articulates with the shoulder blade at the top and with the bones of the forearm at the bottom. It consists of a diaphysis and 2 epiphyses. The humerus has 3 surfaces, anterolateral, anteromedial and posterior. 3 edges, lateral, medial and anterior. Set up at the top, the rounded end of the bone. Inward, the articular surface of this end. Forward, the groove running vertically along the upper end. Skeleton of the forearm. The skeleton of the forearm comprises 2 long bones that move relative to one another. These are the radius and the ulna. These 2 bones are connected by the proximal and distal radioulnar joints, and by the interosseous membrane, which fills the space between them. These 2 bones, by virtue of their morphology and arrangement, enable a movement of great importance in humans, namely pronation and supination. Radius. The radius is the lateral bone of the forearm. It articulates with the humeral condyle at the top, the carpal condyle at the bottom and the ulna on the inner side. The radius consists of a shaft and 2 epiphyses. It has 3 faces, front, back, side, and 3 edges, front, back, middle. Set up at the bottom, the largest epiphysis. On the reverse, the face of this end, which is furrowed. Inward, the sharpest edge of the bone. The ulna. This is the medial bone of the forearm. It articulates with the humeral trochlea at the top, the carpal condyle at the bottom and the radius on the outer side. The ulna consists of a diaphysis and 2 epiphyses. It also has 3 faces, front, back, middle and 3 edges, front, back and side. Set up at the top, the largest epiphysis. En avant. Next, the hook-shaped articular surface of this epiphysis. On the outside, la petite facette articulaire de cette epiphyse. Bones of the hand. The skeleton of the hand consists of 3 parts. The carp that responds to the wrist. The metacarpal bone that forms the skeleton of the palm of the hand. The phalanges that make up the skeleton of the fingers des doigts. Carpe. The carpus forms the skeleton of the wrist. It consists of 8 bones arranged in 2 rows. The proximal row consists of from the outside in, the scaphoid, lunate, trapezium and pisiform. The distal row consists of from the outside in, the trapezium, the trapezoid, the large bone and the hook bone. The carpal bone complex is 3 cm high and 5 cm wide. At the top, it forms the carpal condyle, which articulates with the bones of the forearm. At the bottom, it articulates with the bases of the 5 metacarpals. Metacarpal. The metacarpus forms the skeleton of the palm of the hand. It consists of 5 metacarpal bones numbered from I to V, starting from the outside. Each metacarpal bone comprises a proximal base, a body and a distal head. The bases articulate with one another and with the bones of the second row of the carpus, whilst the heads articulate with the proximal phalanges. Phalanges. There are 14 phalanges in each hand. Each finger consists of 3 phalanges, the proximal, P1, the middle, P2, and the distal, P3. Only the first finger, thumb, has 2 phalanges. Each phalanx consists of a proximal base, a body and a distal head. The 5 fingers are the thumb, the index finger, the middle finger, the ring finger and the little finger. The pelvic girdle. The pelvic girdle, or pelvis, is formed by the 2 hip bones, which articulate with one another at the front at the pubic symphysis. It is attached to the back of the spine, at the level of the sacrum via the sacroiliac joints. Each hip bone is made up of the ilium, the ischium and the pubis. In adults, these bones are fused together. Os coxal. The coxal, iliac, bone is an irregular, spiral-shaped bone that connects the spine to the lower limb. It is centered by a joint cavity, which is the acetabulum, acetabular cavity. The coxal bone to be described has 2 surfaces, lateral and medial, 4 borders, superior, inferior, anterior and posterior, and 4 angles, anterosuperior, anteroinferior, posterosuperior, and posteroinferior. Set up on the outside, the joint cavity of the bone. At the bottom, the foramen in the bone. At the back, the notched edge of the bone. The lower limb. It consists of the thigh and the lower leg. The femur is the only bone in the thigh. The patella is a bone located at the front of the knee. The tibia and fibula are the bones of the leg that articulate with the tarsus at their distal ends. The foot is made up of the tarsal bones, the metatarsal bones and the phalanges. The femur. It is a long bone which, on its own, forms the skeleton of the thigh. It articulates with the hip bone at the top and with the tibia and fibula at the bottom. The femur consists of a diaphysis and 2 epiphyses. It has 3 surfaces, anterior, posterolateral and posteromedial, and 3 borders, lateral, medial and posterior. Set up, at the top, the angled end. On the inside, the articular surface of this end. At the back, the most protruding edge. The patella. It is a flat, triangular bone located at the front of the knee. She is about to describe 2 surfaces, anterior, convex, and posterior, articulating with the femur. 2 lateral and medial edges. An upper attachment point for the quadriceps tendon. A lower prominence, to which the patella ligament, or patella tendon, is attached. The tibia. The tibia is the medial and main bone of the lower leg. It articulates with the femur at the top and with the tarsus, talus, at the bottom. The tibia to be described, 3 surfaces, the lateral surface, the medial surface, smooth and subcutaneous, and the posterior surface. And 3 borders, medial, lateral, interosseous, and anterior. Set up at the bottom, the narrower end. On the inside, the process of this end. Forward, the sharpest edge of the bone. The peroneal bone. This is the lateral bone of the leg. It articulates with the tibia at the top and with the tibia and tarsus at the bottom. It consists of a diaphysis and 2 epiphyses. It has 3 surfaces, lateral, medial and posterior, and 3 edges, lateral, medial and anterior. Set up at the bottom, the flattened end. On the inside, the articular facet of this end. At the back, the rough indentation at this end. Foot bones. The foot supports the whole body. It consists of 26 bones, which are divided into 3 groups. The tarsus, consisting of 7 bones. The metatarsus, consisting of 5 bones. There are 14 toe phalanges. The tarsus is arranged in 2 rows connected by the chopart metatarsophalangeal joint. The first row, posterior tarsus, comprises talus or astragalus and calcaneus. The second row, anterior tarsus, comprises 5 juxtaposed bones, which, from inner to outer, are the navicular bone, scaphoid, first cuneiform, or medial cuneiform, second cuneiform, or intermediate cuneiform, third cuneiform, or lateral cuneiform, and the cuboid. Phalanges. There are 14 phalanges in total, 3 for each toe, proximal, middle and distal phalanges, except for the big toe, which has 2 phalanges.